So now we move on to our panel discussion. This is the longevity protocol, whereby we're exploring the intersection of AI, wearables, and longevity itself. Obviously, we're joined by Sally Ann, who's obviously from Microsoft and that whole ecosystem that she's just shared with us. Jasmine Smith, who you've met from Rejuve AI. Shavini Fernando from Oxyware, who has literally just got off a plane. I think she's just booked into the Shelbourne. She might be wearing flip-flops if she's just arrived. So I just said, like, join us. It's authentic. It's a good story to share down the road. And also Kennedy, who you met also from Rejuve. So I'd like to see how we can dive into AI and wearables. And how we can actually work together with these devices to promote longevity and ultimately, as I said, to improve healthcare outcomes. So if everybody would like to join us on the stage, Shavini, if you're here, Jasmine and Kennedy. And if Shavini is not here, she'll join us shortly. Do we have Kennedy in the room? We can always start off with 2, work to 3, and then end up with 4. And I'm going to try and actually, I've got 2 wearables myself on at the moment. I might have mentioned my Apple Watch, but also my Whoop, which is checking out my heart rate variability. And I've also got this incredible thing that I got in Washington, D.C. last week, which is called an Oxyware. It's a pulse oximeter that Shavini, who's just got off a plane wearing her flip-flops, has designed. So I have to say, wearing all these wearables, I'm starting to feel I'm one step away from being a cyborg. And maybe someday this will start, my pulse oximeter will start giving me some life advice. So welcome to the stage again, Jasmine. And I suppose we're talking about AI and wearables and longevity. Jasmine, how do you see the whole ecosystem of those things that I've just described being able to promote longevity and improve our healthcare outcomes?
Yes, it's very convenient, and now, especially with the wearables kind of looking more like normal jewelry now. It's something that people are already into, that they're already kind of just wanting and desiring for their own health and wellness. And so as we continue to synergize all of this, we're able to get more of those live in-person insights, as you were mentioning earlier in your talk, where it's no longer that you're waiting until you feel sick to take some action, but that you're actually able to kind of get that live biofeedback in real time. And the cost of the devices continues to come down as well as more and more of these technologies emerge. And I mean, like the one that you mentioned, the healthy, that space is super exciting too, where, if you can't afford, a $300 smartwatch, if now that there's a way you can just use your phone to get some of that biofeedback, that's even more amazing for the space.
I think nearly every 6 months we start to say we're undergoing a pivotal change in technology, and we've seen, as I said, 3.5 to 4 ChatGPT. We're now 4.0, and we're heading very soon to 5. Sally Ann, you're at the co-face of all these remarkable startups around the world. You must be tremendously stimulated, excited, and see huge potential that is yet to be captured.
Yeah, I mean, it's first of all, I love my job, and it's super cool. But we think about all of the innovation that's happening, and we look at the large language models and all of these things that are coming to the fore. But I think it was your keynote, your virtual keynote, gentleman. I came in that way at that time, and I don't remember his name.
Yes, that was Dr. Michael Zuck. Yeah.
Yes. That it's really. We need to make sure that everything revolves around the human, that good technology without usage is bad technology. And so I try to infuse with the startups, think about your users, think about the end patient, think about the providers. One of the things that often happens, and you mentioned, you've got these different wearables, great. But if we think about this from the perspective of, I've got this app over here, that app over there, the patients aren't going to use it because it's too convoluted. and the practitioners are not going to use them. So the potential is there, but we have to think of this with the human-centered approach, and we have to think of this as an ecosystem. I think even Kennedy was talking earlier about the fact that there's enough work for all of us, and the technology is just one piece, and yes, it's moving quickly, and it's hard to keep up, but that in itself is not going to solve the problem. We need to be working together, collaborating, sharing, and we need to keep everyone that's involved in the ecosystem at the center of what we do.
Yeah, and I think rings are kind of, if you kind of zoom back at planet Earth, it's an incredible mass of land that has zero borders, and it's just filled with people of different cultures and colors. And people is what we're all about. It's not about, profits. It's not about all the other things. Ultimately, why we're doing what we're doing. And if you have genuine passion, which everybody who's been on stage today clearly has, it's because we are focused on people and outcomes. If we look at the opportunity, it's a big world without borders, potentially, and technology is allowing, global democratization of knowledge. It's no longer the doctor that knows best, it's the patient knows best. It's no longer physical, it's virtual. So the opportunities are there, they're expanding at a rapid rate, and it's really about getting together those platforms and putting on all those multimodal biomedical data sets and making it reasonably understandable, and as I said, trying to connect that data side of your brain with the creative, emotional side. So it's a big challenge, but big challenges are great opportunities. What do you see happening in the next year, Sally-Ann, and potentially over the next 5 years? Can we get over our borders that are man-made?
Yeah, I think when we look at like the next 18 to 24 months, I do think we will get the whole large language model under control. We have now new technologies that are helping us make sure that we ring fence the sources that we're using so that we don't get models that are not grounded in reality or that are not salient to the question that you're trying to answer. So I think we'll get that under control. I think there will, you mentioned GPT-5, it will continue to evolve, but much like we kind of changed how we worked when the internet came into being for all of us, I think in 5 years, and this goes to like the longer term, we won't talk about large language models. We won't talk about AI. It will just be how we operate, and I don't mean in a surgery way. But the other thing that I think we're going to see more of is the virtual approach, not only to like telehealth, but to collaboration. So there are a growing number of organizations, startup organizations specifically that I know of, that are working to scale medical knowledge. So you're in a remote area of, I don't know, South America, and there's no maxillofacial surgeon, but there's one that's available through technology from the US or Europe that is guiding that, not with a surgical robot, but actually looking at the same thing that the on-site surgeon is looking at and helping and guiding and all of that. So I think those types of things that solve access problems and break down those borders will continue to grow.
And there's a great Irish book written by a Limerick man called John McGahern, and it's called Amongst Women. And I'm amongst 3 phenomenal women who are very diverse, a group of gals and 2 sisses, and I think hopefully Shavini and her flip-flops will hit the stage soon. And she's got an incredible story, and it's a very personal story, personal for outcome that is something that is really powerful, and I'm wearing it here in my ear today. She's not talking to me on it, but I'm really looking forward to her joining us and sharing her true story. Can I ask you, Kennedy, and thanks so much for joining us again.
Sorry about the confusion.
Not at all. Sally-Ann was talking about collaboration on a kind of a global scale, and yourself and Jasmine are very used to that concept. We talked about it briefly. How can organizations across the globe enable proper collaboration to really drive innovation in the field of AI wearables to result in longevity?
Well, I think collaboration starts with effective communication and collaborating not only on the commercial side, but also on the nonprofit and advocacy side as well. I know on the Rejuve Bio and Rejuve AI side, we've had a lot of contact with like the Lifespan IO and Life Extension Advocacy Foundation. We're in talks with them for establishing maybe a global data commons, some effective lobbying with governments for driving more investment into the space. Those are some conversations that have started just recently in the last month or so. Nonprofit work and advocacy is also something that's very near and dear to my heart. So doing some of the groundwork, some of the grassroots stuff, I think is also essential to collaboration and having more effective communication. And that also factors into wearables too, and like partnerships with these wearable companies, which also contributes to more effective data sharing. And with our advanced AI, more data is better. Like you said earlier, data is currencies. Data is essentially the new oil, basically, and that's how we're going to get these more effective treatments into the clinic. And collaboration and effective communication is essential.
Sure. And Jasmine, you come from a very good data science understanding of the basic core of data. What do you see as the most promising developments in the space and future directions to really improve things from a wearable AI and longevity perspective?
I just think it's exciting in general that the wearable devices are getting more sensitive, like how we were mentioning earlier with the pulse oximetry, like the fact that now, with the AI and just advent of technology and the global interconnectedness of everyone, we're able to pinpoint the technological issues and fix them faster. We're able to identify, okay, if this device is not working for a certain population, how do we improve that? How do we get the data and fill that in to actually make it so that everybody can have a wearable device that actually measures things accurately, works for all different types of people. I think just overall, like the idea that everyone will soon be able to own and wear such a device, and it's just going to improve preventative healthcare overall and globally, which is something I'm super passionate about as well.
But I'm really now amongst women, and this stage has just suddenly been supercharged by an incredible person who I met for the first time last week in DC. Folks, can we just welcome to the stage Shavini, who is just landed, and I like your flip flops, and you got the mani pedi done. Round of applause, folks, to welcome her, and thank you for joining us.
Yeah, I just straight away came from the airport.
So I think you've got a really personal story, and it's also, to follow the theme of P's, it's very powerful. And also, may I add that it's pulmonary arterial hypertension. I studied cardiovascular imaging in Northwestern, so I knew a fair bit about pulmonary arterial hypertension, rare disease, very difficult to diagnose, very difficult to treat. And I think we talk about AI and we talk about oxygen. So this is a pulse oximeter, and everything in life has a double edge, invariably. So if we take fire, fire can keep your house warm, but can also burn the house down. AI has got positives and negatives. But what really resonated with me last week was oxygen, which we all rely on, and people with chronic lung conditions, like Shavini has, require oxygen all the time. But it has a double-edged sword. It keeps you alive, but it actually causes fibrotic lung disease, which ultimately kills you. Now, will you just tell them a little bit about your story and give them some context as to why I'm so enthusiastic to have you here?
So, I've had a hole in the heart. I had no clue. And I was an athlete. I was a sprinter and I was a swimmer. So I was diagnosed as asthma my whole life. And so I ended up damaging both my lungs and heart by overdoing it. So I got diagnosed only in 2015 when I started turning blue. And then the doctor said, oh, your pulmonary pressure is higher than your systolic, and you got 2 years to live. So, and to just enjoy life. So I'm a bit of a rebel personality. I got on a flight, came to US to get a second opinion from Johns Hopkins, and then they said, I can't go home again. This is my first international flight since 2015. So I was not allowed to get on a flight. And then because of my pulmonary hypertension, I'm very hypoxic. But the thing was, because I was an athlete, I don't feel it. I can function even with 50% oxygen with no symptoms, and I can still run. But then the thing is, when it drops too low, if it doesn't come back again in time, I end up in a cardiac arrest or a stroke. So I've had 4 cardiac arrests, 3 strokes because of hypoxia. And then the doctors were like, you should not live alone, you need to live with someone else. I was like, for what? Because when I had cardiac arrest, there was close to 25 people around me, and I had to revive myself, call 911 on my own. No one was able to help me. All they did was just panicking. So what's the difference of me living alone or living with someone else? So it was just a fire alarm situation. You just need to know when your oxygen drops and have a timely alert so you know to do your first aid and prevent a situation like that. And if needed, call 911 in time. So as a result, I ended up making Oxywear just to prove my doctors that I can live alone without having to depend on anyone else. So it's been 7 years now.
Can you explain, like, Jasmine, or Kenny, did you mention about pulse oximeters not being designed for people of color?
Right.
Yes.
Yeah. So what's different about your pulse oximeter?
So when I started doing this, I started reading all the FDA paperwork and everything, and because I needed to make sure I do everything right. But then when I saw the protocol was like 80% light skin, 10% dark skin. And I'm brown. Where do I stand? So I was like, how do they make this? Like, your pulse oximeter clinical trial should not be based on the market segment. It should be based on who use it. Mm-hmm. And so I wanted to do the trial on equal groups of people. This was way before COVID, back in 2019. And on a larger population. But the thing was, I sent the request to change the protocol. I didn't even hear back from FDA. And we only got permission to change the protocol when FDA was getting scrutinized after COVID that the pulse oximeters are not detecting the numbers for skin tones. Because on the ear, the thing is, if you check the palms, if you touch a palm of a darker skinned person and a lighter skinned person, the darker skin palms are thicker because the pigments make your palm skin thicker, and same with the fingernail. So when you're reading numbers on the fingers, what happens is the fingernail is different from person to person, the skin is different on the palm from person to person. On top of that, the red light gets absorbed by the pigments. So you have 3 different things to calculate on. But on the ear, there is no fingernail, there is no palm skin. It's the same skin as everyone else. All we need to do is just to calibrate it for the absorption on the pigments. So on the ear, it's actually much easier to handle the skin tones than on the finger because of that.
I think what I learned from talking to you last week was that, you know, this double edge of oxygen. So you require oxygen, I require oxygen. If I go below 90%, I need to be put on oxygen. If you go below 80%, you need to be put on oxygen. So you and I are different.
Yeah.
But also, you don't need to be on oxygen all the time.
Yeah.
Because sometimes you're relaxed. Sometimes your system is just coping better. Maybe you've got an infection, so maybe your system is a bit stressed. So throughout the day and throughout the month, your oxygen needs, sometimes you need it and sometimes you don't. But most people in your situation just wear it all the time.
Yeah.
And what does that do to the lung? It kills the lung slowly and you die. So this pulse oximeter is constantly through your phone measuring your oxygen level, and you go, oh, alert, turn on the oxygen,
Yeah.
turn it off. And then actually what you're doing is you're keeping your lungs healthier for longer,
Yeah.
and you're not stressing the system.
Yeah,
So
exactly.
you've removed that sword.
Because you're not making them lazy, because otherwise what happens is they just get lazy because the lungs work is done by someone else. Right? So, like, this is my oxygen, it's on the floor.
Yeah.
I just carry it around, and only when I need it, I wear it. Otherwise, I don't. But before I made Oxywear, I was on it 24/7. And after I started making wearing the Oxywear, I was like, I don't need this. My numbers look fine. Why am I wearing oxygen? So it's just about knowing when you need to wear it and when not to wear it. Because the reason why most of us who has lung conditions wear it is because we don't know whether we need it or not, but the thing is, once you choke once, you don't want that feeling again. So everyone's wearing it just to be safe.
So you shouldn't be here, isn't that right? You could potentially be reincarnated. You've gone past your life expectancy, isn't that fair to say?
Yes, it's...
By how many years?
In 2015, I was told 2 years, so now it's almost 9 years.
Incredible. So Sally-Ann, what's really important is that, here's like many things, it's a simple idea, it's basic, and it's kind of a re-education of people about skin color or, the double-edged sword of oxygen, which I wasn't aware of. How do we make these incredible technologies that you're exposed to, what Shavini has showed us here, accessible to the broader population? And that ultimately means that those startups need to become successful startups and scale.
Yeah, so it's interesting to hear your story, Shalini. Did I say it right? Is that right? What is it? Okay, well, thank you. But really interesting to hear your story. And it's one of the reasons why I love healthcare is because the founders that I talk with, like these ladies here, are always so passionate and they usually have a personal story. But when we think about how do we scale, there is a predisposition for people to build apps and go, I'm going to put it on an app store. And that's a non-starter. The best way really is to find healthcare providers, payers, pharmaceutical companies who want to be that distribution channel so that they have, because they already have the methods to scale, they already have the ability. The other thing to keep in mind when you're building these new technologies is that it's great and it's super helpful, but if it doesn't integrate into the larger electronic medical records, the data gets lost. So you have the data, you have it on your phone. How do you get it into your MyChart or whatever you have that is your personal record that you even may have access to digitally, but that they don't talk to each other? So as we look towards kind of the next stage of innovation, it's going to have to be solutions that are easily, going back to the blockchain and, all these other technologies that provide the access to integrate them with existing systems in a way that providers and practitioners can use them through the existing workflows that they have and reduce steps, not add to them. So I tell the startups that I work with, scale depends on not building a point solution, but building a solution that integrates into existing platforms that practitioners and payers and pharmaceutical companies are already using. And the idea of putting an app on an app store is one way to go, and in some cases it works. Your solution is so unique that I think there's probably a place for that. But I've had multiple conversations with people that are building nutrition apps or building exercise apps. And I'm like, have you looked to see how many of those are already on the App Store? You'll never get anywhere. But it really helps to have relationships, going back to the collaboration discussion, with large organizations, hospital systems, NHS, whoever it is, to provide that scalability and that structure because they have the end patients.
Super. Well, maybe over the next 2 minutes we can land things from either side of this phenomenal panel of women. Can you tell us, within 1 minute, where you are in terms of your startup and scaling. But most importantly, will you tell us one of your biggest challenges? And Sally Ann, I want you to tell her how to solve it. No pressure.
No pressure. Okay, here we go.
So we are just in the last phase, the additional information phase of FDA, and getting everything synced to the Epic system, like you said, so the doctors would have it, and signing up with device companies, like oxygen concentrator companies, so they can automate the flow based on the need, and the doctors so that they can use it for oxygen prescriptions and for other stuff. But something what I really learned was that this is a good objective data collection tool for clinical trials, because currently it's only subjective data. As a patient, I know when the weather is bad, I blame my medicine, right? So that's the feedback you get on subjective data is actually subjective. So I'm trying to figure out, like, how do I actually make use of this so that the drugs and everything is actually having actual data for efficacy, not just the subjective data.
Yeah, I mean, it goes to, the trials and going back to, and you weren't here, but going back to getting funding to connect your solution with providers that will generate the real world evidence, and the ability to draw a direct line between your solution, fewer readmissions, fewer ER visits, and all of that. And did you get 510K or?
510K just in the additional info. So August we should have the 510K. It's a class 2.
Great. Yeah, I think it's tremendous.
Thank you.
Yeah.
Super. Well, listen, folks, I think we've had an incredible panel discussion here. It's just so people-focused, and it's so authentic, and it's also so passionate, and it's also a privilege. God, I'm really into my P's today. So, Shavini, Kennedy, Jasmine, and Sally Ann, thank you so much for joining us, and a round of applause, everybody. Thank you.